It's time for another GI focus on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Tina Nunziato, and with me is the beautiful Dr. Liz Cruz. Welcome to your show, Dr. Liz Cruz.
Thank you.
Thank you so much for joining us. If you are a first-time listener, welcome. Welcome to this journey that we're on, over 500 podcasts. If you're a regular listener, thank you. Thank you for joining us. Thank you for continuing to listen or watch if you're on YouTube, because we're pretty beautiful. So if you're not watching us on YouTube, you should be watching us on YouTube. Anyway, today we're going to do another GI focus where I ask Dr. Cruz a lot of questions and she answers them. And we hopefully try to educate people on different things going on with the GI system. So today's GI focus, Dr. Cruz, is going to be on tubular adenomas.
I love tubular adenomas.
Otherwise known as TAs.
TAs.
Which I see on your result letters all the time.
Yes.
Okay, so we're going to talk about tubular adenomas. So first of all, Dr. Cruz, what is a tubular adenoma?
In my world of what I do, tubular adenomas are typically polyps. They're tubular adenomatous polyps that I find that I remove from the colon. I would say the majority is from the colon. However, sometimes you can have these tubular adenomas growing anywhere in the intestine. I've removed them from the stomach, from the small intestine, but I would say by far the most common spot is the colon.
Okay, and is there a difference between just a regular polyp and a tubular adenoma? Like what makes the polyp a tubular adenoma?
Great question, Tina.
Thank you.
Yeah. All right. Typically, polyps, when we go into the colon, so let's just focus on the colon.
Yeah.
Just, because that's the most
common. Let's keep it simple.
We'll keep it simple.
Yeah.
The whole reason for doing a screening colonoscopy, which should start at the age of 45, if you have, if you're normal risk, is the main purpose is to go in and to look for polyps. And if I find any polyps in there, get them out of there. Take them out, remove them. And my philosophy is that no polyp gets left behind. and so everything is removed. And I just say that because you could look at these polyps, you're looking at them with regular white light, which is what is in the camera, the scope. There's also another wavelength of light that's called narrowband imaging that we look at the polyps. And they have characteristics where you can look at it and determine whether this is precancerous or not. I was just taught to remove them all. I know that there are some gastroenterologists that will look at some of these polyps, especially in the rectum. You tend to get a lot of little polyps in there. And sometimes, depending on what it looks like, some gastroenterologists may leave some behind because they look at it with a different wavelength of light and they can determine, oh, this doesn't need to come out. I've always removed them. It's a way I was taught. I just can't get that out of my system. And so every polyp that I see gets removed. And so when you look at the polyp, then you take out the polyp and then you send it to the pathologist. The pathologist takes a look at that tissue and then you get a report back. The pathologist tells you, this is this type of polyp. This polyp was a tubular adenoma. This polyp was a hyperplastic polyp. And I would say that the most common polyps are tubular adenomas and hyperplastic. You can get different other types of polyps like sessile serrated adenomas. You can get tubulovillous adenomas, but we won't, again, to keep it simple, we'll focus on tubular adenoma. So the pathologist is the one that then sends me back at the report and I look at it and determine, oh, okay, these are all the polyps I took off. These were tubular adenomas. These were not. And then take it from there. But basically, they're polyps.
So if it is marked as a tubular adenoma, is that precancer, cancer? What is that?
That's considered precancer. Precancerous polyp. which is still benign. Precancerous meaning that if you left that polyp there over time, it will eventually grow and turn into a cancer. Okay. It's precancerous.
So precancer, but
Right.
not cancer.
Not cancer.
Okay.
No.
But it is important to have all those removed.
Yes, absolutely. Oh, yes, absolutely. All those tubular adenomas
you want out of there.
Yeah. And you know, and I will tell you that I have done many colonoscopies where I will find multiple little polyps in the rectum. And I do, you know, I'll look at them with, of course, the white light, which is the standard with the scope, but then I'll switch off to the other narrow band imaging. And I can tell by looking at them, I'm like, okay, this is probably nothing. But because of my analness, I will remove them all. And I've had times where maybe I took off 10 in the rectum, and the pathologist will say one of them was a tubular adenoma. Okay, so
if you would have left them.
Yeah, I just feel that they have to all come out, because sometimes you can get a little microscopic tubular adenoma that maybe just starting to grow, and maybe, you know, maybe it's right there next to, I don't know, a hyperplastic polyp, which is completely benign. But anyways, a tubular adenoma is precancerous. If you leave it there over time, it will grow into something more worrisome, like a cancer. And it does take polyps time to grow. So it's not like overnight it's going to grow, you know, into something, but you just want to get all those polyps out of there.
By the way, I just realized you using the word analness.
Oh, yes.
You are pretty anal when it comes to your procedures. And I think it's funny that you're in the anus being anal.
Yes.
It just kind of hit me just now that
that's
your
right.
analness, you actually picked the right career.
I did.
For your
did.
analness.
I love what I do.
Yes.
And you're right. You're right. I'm in the anus being anal.
Exactly.
In the rectum.
Exactly. I just wanted to point that out.
Yes,
anyway, so the next thing I want to ask you is with regard to tubular adenomas. So
Yes.
obviously having a screening colonoscopy, you would find tubular adenomas, and that's normal, and you want them out.
Right.
A lot of people ask you when they come out of their procedure, how do I avoid getting these polyps or tubular adenomas going forward, right? I mean, even though depending on, so, I mean, normally I ask you like, what do you do for these, right? I mean, or how can you prevent them? Or the other question is, depending on how many you find will determine when that person has to come back.
Correct.
Right. So talk a little bit about that in terms
Okay.
of if you find just one versus if you find 5 or 10, what is
Sure.
your recommendation there?
Yeah, so we do have guidelines. There are guidelines that are put out, and as far as, you know, what is recommended, like if we find 1 to 2 tubular adenomas, the guideline says 7 to 10. And mind you, these guidelines were changed a few years ago, because up until, I don't remember when they were changed, maybe it was 2020 or 2021, but up to that point, if you had even 1 tubular adenoma, you would never go more than 5 years before repeating a colonoscopy. But then the guidelines changed, and it's like if you have 1 to 2, you know, repeated in 7 to 10 years. If you have 3 to 4, 3 to 5 years. If you have 5 to 10, you know, 3 years. If you have more than 10, definitely within a year. So in general, those are like the guidelines that we follow. However, it's also dependent on the size of the polyp, because if the polyp is 1 centimeter or greater, and let's say even that you only had 1, then you're going to repeat it at 3 years. If you're not fully cleaned out, like if you still have stool or even liquid stool in there where the prep isn't, you know, the prep is fair, typically, no matter what the guideline says, I'm going to bring that patient in sooner, because it just means that we could have missed something. We could have missed maybe a flat polyp that just wasn't well seen because of, you know, the residual stool. They weren't totally cleaned out, you know, and we're not even touching on family history, because that also changes the guidelines. That also, you know, the guideline varies. Like if there's family history of colon cancer in a 1st-degree relative, like a parent or a sibling, or even in 2 or more 2nd-degree relatives, like aunts, uncles, grandparents, cousins. So that kind of takes you along a different pathway. But yes, there are guidelines that we have set in place for the number of tubular adenomas. But you always have to take into consideration the prep, the clean out,
and
the size,
the family history
and family history.
So there's a few different factors involved
Yes.
with when the person
Yes.
comes back. Okay. And then the question that you get all the time with regard to what can I do to avoid these? Or if they have 10 or more and they're looking at you like, what can I do to reduce the number that I have?
Great question.
What do you normally tell them?
So I always tell them, okay, so look, somebody that has more than 10, they're coming back, you know, definitely within a year. They're coming
You've
back.
won another colonoscopy.
Yeah, that's, they're coming back. And it's funny because sometimes I'll have patients where I find multiple and they're like, hey, I got I won the lottery for the number of polyps, so I was
It's
joking.
not something that you want to win.
Exactly. But most of the patients will kid around about it.
Yeah.
But recently I did a guy who had like 20 something polyps.
Wow.
And most of them were in the rectum. And I was like, you won for this, today you're the winner. And he did not think that was funny at all. But a lot of patients usually think like, oh, I have a high number, I won, even though they know that you don't want to have a high number. It's not great.
Yeah.
But patients will ask me all the time, oh my goodness, what do I need to do, so I can cut down? I mean, the simplest things that I tell them, things that they can easily start doing is in their diet. All right. I tell them, look, you want to make sure that you're eating as clean as possible, avoiding processed food, fried food, junk food, eating a lot of greens. There are studies that show that people that have a higher intake of red meat and processed meats, like the salamis, the bacon, your deli meats, all of those are processed meats, and then red meat. Okay. They've done studies that have clearly shown that the group of people that had a higher intake of red meat and processed meat had a higher incidence of colon cancer versus the group of people that did not.
And a lot of people are eating deli sandwiches
almost
every day for lunch,
Yeah, deli meats are huge.
And I feel like too, like a lot of people that are trying to do better, for example, and they may not eat fast food like Chick-fil-A or McDonald's, they're going to Subway, right? And they're getting then a deli meat sandwich in those situations. So you really have to be careful.
You really do. Yeah. The deli meats are processed meats. Okay. And so I tell them, cut down on your intake of red meat and your processed meats. Drink a lot of water. Drink a lot of water. Get a lot of greens. Water is just, your body needs the water. Your body is mostly water. You 80% of your body, you're like a water sack of, salty water. Okay. So you need the water. It helps to flush out your system, get the toxins out of there. So I will have many patients that tell me, well, I don't drink enough water. I'm like, look, you need to drink more water. You need to cut down on energy drinks, coffees, sodas,
especially the fancy coffees.
Oh yeah, big time.
A lot of people are buying Starbucks or Dutch almost every day. Even our young people are buying these things every day. And a lot of those drinks, it's not just coffee. It's chemicals,
sugar. Yeah. So yes, I try to encourage them to drink, and I tell them, look, a good rule of thumb is drink half of your body weight in ounces as far as water goes
per day.
Yeah. Not per week, per day. And some patients will tell me, hey, I don't like eating greens. I have a hard time with that. Or I eat one salad a day. That's not enough. Okay. You need more greens. So I will actually encourage them to get on our greens.
Yeah.
We have greens in a capsule. I mean, greens that have been dried and pulverized into powder that you just take. Greens. Yeah, take some capsules every day. That's going to give you the greens. And I also tell patients, take this in place of your vitamin, okay? Because I'm finding a lot of whole intact vitamins in the colon. So basically that vitamin didn't even break down. They didn't even get the benefit of that vitamin because now it's in the colon. They're just going to poop out that vitamin and they're wasting money.
Yeah.
They're wasting money. I also tell them in the same vein of drinking a lot of water to flush you out, get the toxins out. I encourage them to get on our detox. Which is a very gentle protease that breaks down these proteins that your body doesn't need, that just causes, that is just toxins in your body. And it's very gentle. It doesn't have you tied up to the bathroom. It works at the systemic level.
Yeah.
And so, these two things are huge, the greens and the detox, and just encouraging them to drink more water and watch their diet. Be careful with your diet. I mean, those few things, for some people, it's a lot. It's a lot, especially if they're not drinking a lot of water, especially if they're used to eating a lot of fast food and they're not getting their greens. So just those few things is a lot for some people to take in and to incorporate into their lives.
Yes. Okay. Anything else regarding tubular adenomas that I did not ask you that you think is important to share?
Yeah, no, I mean, just to emphasize, so tubular adenomas, again, considered precancerous, which is still benign. It's not cancer, but those are the polyps that we need to get out of there, okay? Because those are the ones that if we leave them there, eventually over time, will grow into a cancer, okay? And I just want to do a shout out for screening colonoscopies, okay? The age is 45 years old, assuming you don't have any family history of colon cancer, 45 years old. And this procedure can save your life, okay? Colon cancer, second leading cause of cancers in the USA, okay? That can lead to death. There is no reason why anyone should be getting colon cancer anymore. However, we're still seeing a lot of it. All right. We have a colonoscopy, which is the gold standard for colon cancer prevention. And so please pass this message on to your family, to your friends. 5 years old, if you hadn't had a screening colonoscopy, get it done. It could be life-saving.
Yes. Well, thank you, Dr. Cruz,
for
sharing about tubular adenomas. And thank you again for everyone for joining us. If you have not subscribed to our podcast, please subscribe so that you never miss an episode. If you want to connect with us, please go to our website, drlizcruz.com. You can schedule a free 30-minute consult as a gift from Dr. Cruz, absolutely free over the phone. And we just look forward to catching you on the next one.
Thank you.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.